And so what strategies could a patient use when the patient is facing up with this problem of urinary urgency and urinary frequency? There certainly is no substitute for a patient seeking a urological opinion. You really need to see a urologist because some other conditions may need to be ruled out. But I think that patient education and a patient awareness that at least some of the symptoms could be caused by Parkinson's disease would help the patient manage his or her own condition. Of course, one of the issues would be, how do you time yourself? If you know you're going to take a long trip, then maybe you shouldn't ingest as much fluids before that long trip, so that it doesn't force you to urgently look for a restroom. But other than that, what you need to be aware of is that there are medications that can calm down the bladder. And those medications are, in fact, a number of bladder relaxers. They relax the muscle of the bladder. And it's important to distinguish between those medications that relax the bladder muscle from those that relax the sphincter of the bladder. And the ones that relax the bladder muscle include oxybutynin, which is also known as ditropan, tolterodine, which is also known as Datrol, sulfenazine, which is also known as Vesicare, and darifenacine, which is called Enablex. There may be some others in the market, but they are basically functioning through the same mechanism, which is bladder muscle relaxation. Some urologists have a preference for using medications that relax the sphincter of the bladder rather than the bladder muscle itself. Medications that relax the sphincter of the bladder are, for example, Flomax is the brand name, or Hytrin. And although they may work, in my personal opinion, the medications that relax the bladder muscle are more effective.